Dr. Shanthi Priya.
Yes, ma'am.
You have attended our first week course, and I will like you what you learned in male infertility and andrology. How this particular course for the first week has made you better doctor.
Yes, ma'am. Initially, I have learned how to investigate and examine the male and when to intervene.
Were you scared before joining this particular course?
Yes, ma'am. I never used to go into deep investigation about male infertility. It was I only used to stop at semen analysis.
Okay. So now your knowledge about how to do a full workup of a male infertile patient, you're very crystal clear.
Yes,
what all are you've gained?
I have gained that I should do DNA fragmentation test. I should advise
for examination, basic test,
history taking,
and DNA fragmentation is very, very informative, and it should be done. It should be part and parcel of every investigations of the male. How are you comfortable with azoospermia?
Azoospermia also I have understood properly, ma'am. What is obstructive azoospermia, what is non-obstructive azoospermia, and
how to investigate, how to come to diagnosis.
Yes, ma'am. How to come to diagnosis? What in which case we can go for conservative management, like when we can advise them for flood them up with antioxidants and all those things.
Genetics has become clear to you in relation to male infertility.
Yes, ma'am. And even though the new thing I have learned is Klinefelter syndrome, we can advise for same.
He can also father the child, provided the sperm is retrieved.
That I have never
prognosis.
known. Yes, ma'am. And
how was the andrology sperm function test live demonstration? How was it?
It was very nice, ma'am. Swim up technique was simple wash up, swim up techniques, density gradient, double gradient, everything was very nice. And even PRP.
How was the PRP session? I'm going to take the class now.
PRP session is also very nice, ma'am. How to prepare, how much we have to take, how much we have to centrifuge, everything was very nice.
So as far as your training of the male infertility and andrology in the first week was concerned, you felt very nice?
Yes, ma'am. I have learned a lot actually. I never thought.
Learned a lot. Yes, you come with the information was our 4 to 5% you know, and you find that you go with a 90% plus knowledge. Now, this is good. Now, what about the female infertility and IUI was concerned? Are your fundamentals clear in that particular thing?
Yes, ma'am. My fundamentals got cleared.
What all are the positive points?
The positive points is I have learned how to stimulate and how to monitor IUI cycle initially, and even before that, how to investigate a female properly. Economically in a single month, how can we investigate a female properly? And I never thought that doing progesterone on 21st day would be of so much of help while investigating only. And the protocols, letrozole and clomiphene, simple protocols, but with those simple protocols only we can get lot of success. That's what I have learned from your classes.
First 3 months, if you concentrate, but you must investigate them and then you give a treatment, it will be very, very rewarding.
And I never thought with clomiphene and letrozole alone, no need to give luteal phase support. I never thought there is no need to give luteal phase. We used to dump patients with the first one, even with clomiphene and letrozole. And
no, I get the scientific knowledge about this luteal phase defect. I covered in detail about this, and I think that was great.
Yes.
So, were you happy with the first week course?
Yes, ma'am.
So, Shanthi, are you very happy with your first week course? Do you think there is any changes we need to do it, or you feel super saturated?
Yes, ma'am.
Happy?
Knowing so much in 14 days is a lot, ma'am. Actually, I'm very much happy.
But no, we are very clear about it. Anybody who is trained by Dr. Shada Jain and team is superb. The only thing what we want is that, you should speak to a couple of your friends. So this particular cycle has a ripple effect. If you learn something, your friend should also learn. Like I
Yes,
will
ma'am.
suggest you that you will do one course which we call a critical care in obstetrics. It is awesome. You will feel कि डॉक्टर साहब आपने क्या पकड़ा दिया हमारे यहाँ.
Yes,
Okay?
ma'am.
So that is it. We are very happy about it.